Genetic testing and screening. Genetic screening and genetic testing are two different things. Genetic screening allows for doctors to determine if an individual is more susceptible to a genetic disorder or disease. Screening does not provide a diagnosis, and because of this, they're not entirely accurate. Testing is considered a much better alternative. Genetic screening is used to help diagnose any possible genetic disorders found in newborn babies and their mothers. Genetic testing is a type of medical treatment used to identify changes in a person's genetic structure. These tests look for any anomalies or mutations in the DNA to determine whether genetic disorder is present or could occur. Although testing does give results on whether you may be susceptible to some diseases or possible genetic disorders, it doesn't guarantee that anything may or may not develop. So how does it work then? Genetic screening uses different ultrasounds and blood tests to determine whether the baby and mother are healthy. Genetic tests are performed on a sample of the individual cells. Typical cells used are blood cells, hair cells, skin cells, etc. The sample is then sent to a laboratory where technicians look for any sort of changes or abnormalities in the chromosomes, proteins, and DNA. The technicians will record their findings and send them back to the individual's doctor or right to the patient. Tests can be performed on newborns as well, where the sample is taken from the blood with a prick on the heel. How is genetic testing and screening important? Well, genetic testing and screening allows us to examine our genes and see if there's any sort of genetic problem. Because of this, we can determine whether our children could develop some gene mutation or disorder. Being able to know these sort of risks makes it possible for development and treatment and cures for some disorders. In addition, knowing that your child has a possible disorder before it is born can prepare you on how to best be ready for your child. Social and ethical issues with genetic testing and screening. An individual's confidentiality is very important when it comes to all fields of medical and science. Employers have been known to deny an individual based on their genetic disposition solely because they believe that they can then become a liability based on a certain possible condition or disorder. This discrimination is socially unacceptable but cannot be completely avoided, therefore confidentiality is key. Although it is important to keep an individual's results private, by not disclosing results to third-party family members, they are at a risk of the same possible disorders. In addition, if an individual feels the desire not to undergo testing, they could be the target for denunciation based on the social normal of the community. My opinion. My opinion on genetic testing and screening is quite positive. I believe that it is benefiting our society, and although that there are some social issues with it, no harm is coming to the patient getting tested or screened. As said by a site, Nature Education, that I have quoted, Down syndrome, on the other hand, is by far the most common chromosomal abnormality affecting 1 in 800 babies. 1 in 800 is 8%, and although that doesn't sound like a large amount when compared to roughly how many babies are born each year, that number increases exponentially. By performing genetic tests and screening, parents can learn if their child might develop Down syndrome or another sort of genetic disorder and help prepare possible doctor visits or tutors, or just how to prepare for their child. If there's previous family history of genetic disorders, it would be wise to get tested so you know more about yourself and what sort of diseases or disorders might develop. With all that being said, it is your health and your body, and you have every right to decide to undergo testing or not. Thank you for watching. If you have any questions, please contact me, and the references are on the next slide below.